Hey guys, Dr. Chris here with Mid-Atlantic Chiropractic Center. Today we're going to talk about hamstring strains. So we've been seeing these a lot now that the weather's getting warmer. People are getting out there riding their bikes, running, whatever it may be. So a hamstring strain is damage to the muscle in the back of the leg. There's three muscles, your semimembranosus, semitendinosus, and your biceps femoris. And there's actually three grades. First grade is just very minor tearing of the muscle. Grade 2, there's more tearing throughout, but not quite a complete tear. And grade 3 is the most severe, so that's when the muscle is completely torn. Sometimes that may require surgery. So what to look for when you have a hamstring strain: it will be painful, even painful to the touch in the back of the leg. So you may have heard like a pop or a click, felt a click within the leg. You may see some inflammation as well as bruising. That may indicate that you have a hamstring strain. You also notice pain with movement, or even just sitting or whatever it may be, putting pressure on that area may cause discomfort. Some things that you can do if you have a hamstring strain: ice will help to decrease inflammation, decrease your pain as well. Ideally, you want to get it moving within the pain-free range. Work on just very gentle movements, very light stretching, and then once you're out of pain, you can work on strengthening those muscles again to prevent this injury from happening again in the future. How can we help with that? We can do an assessment to determine the extent of the hamstring strain, and based on that, we can determine a treatment protocol for you that may include corrective exercises, strengthening exercises for the hamstrings, the quads, the hip muscles. We can also do laser therapy, so that'll help speed along the healing process. That way you can get out of pain faster, get back to doing what you love much faster as well. Based on the extent of the injury will also depend on your recovery time. So a grade 1 hamstring strain, you may be back within a couple of weeks to full participation, versus a grade 3, that's going to take a lot more time, a lot more rehab and things like that, just to get you back to doing functional activities. It's very important that you get a full assessment done to determine the extent of that injury. Once you have sustained a hamstring injury, the recurrence rate is very high. So if you've already injured your hamstring, the chances are you may injure it, or probably will injure it again in the future. So it's very important that you do the proper rehabilitation, the stretching, the strengthening exercises to work on those muscle imbalances. That way you can prevent yourself from sustaining this type of injury again in the future. As chiropractors, we can also do a biomechanical analysis to determine if your biomechanics for whatever activity that you are doing is proper. That way we can prevent these types of injuries from happening. So if you or somebody that you know has sustained or is suffering from what you think is a hamstring strain, give us a call and we'd be happy to take a look at it for you. I hope this video was helpful for you guys. If it was, let us know down below. If you have any questions, leave us some comments, like, subscribe, and follow for more information. Take care, guys.